I am great. How are you?
I'm really good and super excited to be mouthing off with you today.
Yes, I love it. Oh, mouthing off. How fun. I feel like I haven't seen you in a long time, and yet here you are all over the place. Your business has grown so much. So just tell us a little bit about yourself, give a little background, and how you got into teeth.
Yeah, I'm a registered nurse. So I've been a nurse for, oh gosh, 35, 36 years now. And I went back to school. I'm a nurse anesthetist. I have a master's degree in anesthesia. Hold on. When I was turning 40, my husband and I got married, and we were looking at alternative, healthier lifestyle options. And so when we ended up having our daughter, she was about 2 years old. I'd already been making this skincare product. So I started making skincare products after I miscarried. And the miscarriage opened my eyes to all the toxins that were polluting the beauty industry, all the products that I was using. And I was blown away by that. So I started making a bunch of skincare products. And then our daughter at the age of 2 had a molar that came in that had a defect in it. It had a natural cavity. So I took her to the dentist, and the dentist took one look at that tooth and said that the tooth was most likely going to have to be pulled within a year. We would put a temporary filling in it. And every 2 or 3 months, that filling was going to fall out. And every time it fell out, we would decide if now's the time to just pull the tooth or put another filling in it. As I was leaving the dentist office, he said, don't worry, Mom. We put a temporary filling in, and now we just hope for the best. And I don't know about any other moms out there, but the last thing you do is hope for the best when it comes to your kids. You know, when it's you, that's another story, right? Sometimes, but when it's your kids, you're like, there's no way. So I started doing my research, and I came across Dr. Weston A. Price, and I discovered he was a dentist in the early 1900s. We've been using his baby formula recipe, which is an amazing recipe. But I started looking at the research that he did on dental health, and I was blown away at what he discovered way back in the early 1900s, the link between sugar and bacteria to cavities and gum disease, and how the root cause of most internal health issues is inside the mouth. It starts inside the mouth. So anyway, to make a long story short, I did the research, and I created my Dirty Mouth dental products based off of his research. My daughter's tooth, the one that was supposed to fall out or be pulled within a year, fell out naturally at the age of 12. And that original temporary filling that was supposed to last 2 months, maybe 3, was still in place. And the tooth had actually remineralized over that temporary filling to protect it from bacteria.
Wow, that was such an amazing story, and there's so much to unpack here. Absolutely love the work of Weston Price. There's a couple different organizations that perpetuate his work, so definitely Google him and find out. He also founded the ADA, and there's a lot of really amazing things about him. But of course, they wouldn't be following his precepts today, ironically. But you're so right. Like, the mouth is where everything comes in. This is the start of your immune system right here. As we're chewing things, as things are coming in here, and our oral biome has such a huge impact on the rest of our body because it's impacting everything that's coming down here. And it makes me think of the old saying, like, don't look a gift horse in the mouth, because the mouth is where you see the health of things. And so, but let's talk about remineralization, because I think a lot of people don't realize that just because you end up with a cavity doesn't mean that you automatically have to get a filling. And of course, I want to talk about the different types of fillings there are. I've personally had all of my mercury removed, and but let's talk a little bit about remineralization and what that is.
Yeah, so I love what you said, that people don't know about it. That, when you go to the dentist, a typical dentist is going to give you one option. That option is you need a filling. And I always tell people, when they find me and they have cavities, and they're wondering, can I, fix this? Can I remineralize it? Or do I need to follow my dentist advice? I typically tell them, if there's no pain or very little pain, minor pain, it comes and goes, intermittent, and there's no infection, no sign of infection, no, redness and oozing and things like that, then chances are really good you have time to remineralize the tooth. So if there's any sign of infection or a lot of pain, typically I say do what your dentist recommends. But remember that whatever caused that to happen inside your mouth, you have other teeth that are in the exact same environment, because the mouth isn't selective. Whatever's going on is affecting everything inside your mouth. It's usually a bacteria problem related to acids and sugar. So those are the three components. And while you can't necessarily get rid of all the sugar in your diet, we can eliminate most of it or a lot of it. And we can also kill the bacteria that's eating it and creating the acids. The acids also come from the foods in your diet. A lot of the foods that we eat create or are acidic by nature. So by eliminating a lot of the acidic foods, using some of the tips that I give my customers regarding the acids inside the mouth, and replacing what you're brushing your teeth with, because the problem with big dental, and I always call big dental, big Cosmo, is that the stuff that they're putting in their products are actually creating more acid inside your mouth, causing more damage to the infrastructure of your mouth, which basically means that you're heading down a path where when you do get cavities or you do end up with gum disease, you can't necessarily on your own fix it. You are just going to continue down that path. Things are going to continue to decline. And most of the dentists are not trained in natural healing. It's kind of like the doctors of the world. There's a couple fixes. It's either medication, surgery, things like that. But there's not the natural healing process of the body. So what I'm here to do is help people understand that you do have a choice, and that it's actually pretty easy to heal a cavity or mend it or remineralize it. And we can talk about that in a second. But the bacteria that's inside the mouth is the main cause of all disorders, including gut disorders, including, problems with immune system and things like that.
Yeah, so, and I just want to clarify, because some people are probably thinking, I drink kombucha, kombucha's acidic, is this ruining my teeth? And I will say, it depends on what's going on in there in the first place. A lot of folks drink kombucha and never have an issue with it, and that's because kombucha also alkalizes in the body. Just like citrus, just like other things, like citrus. That's the other thing I was thinking of. And so, but that said, if your oral biome is already in a place where it isn't healthy enough, it can have a deleterious effect. And so I always recommend, I picked this habit up in Asia when I lived in Taiwan, but drinking through a straw. So I like that because it helps get the liquids just straight back in. It minimizes the amount of time it's in my mouth, saturating my teeth, and it's going exactly where I want it, which is right into my gut. So I love drinking through a stainless steel straw, bamboo straw. That's my favorite way to drink all my beverages, actually. And that's really great advice if you're still drinking soda or things like that, which hopefully you're reducing the amount of sodas you're consuming, because that phosphoric acid really is a negative impact on your teeth. And so drinking soda definitely will have a negative effect on your mouth, because those acids, they're not those same organic acids that we're finding naturally in kombucha. And so just wanted to let people know that it is fine to drink your kombucha, but again, it's like you have to pay attention to your own body. Some studies have shown that kombucha helps to prevent that bacteria that create cavities, but again, it really just depends on your underlying biome. So that's where we got to trust our guts and pay attention to what's going on in our mouths.
And it's a cycle, just like what you're talking about. The whole idea is to create this wellness that just isn't inside your mouth, just isn't inside your gut, just isn't inside your body, like your bloodstream and your tissues. Everything has to be healthy. So if your gut and your internal structures aren't healthy, it's going to impact your saliva production. And your saliva is really what is going to impact your mouth 24/7. You can brush your teeth. You brush your teeth twice a day, maybe 3 times a day for 2 minutes. But what happens the rest of the day? The rest of the day, your body is trying to fight that bacteria and neutralize acids and remineralize your teeth, digest everything that starts inside your mouth. So like you're talking about, drinking things that aren't necessarily healthy for your mouth, but healthy for your gut, like kombucha and other types of things, drinking through a straw is typically what I recommend. Also switching with just a glass of water or, a little bit of water after you eat or drink something that is acidic, especially if you don't have a straw. Just take a sip of water, swish it through your mouth, and that's going to help get rid of a lot of the leftovers that are remnants in your mouth. But just that bypassing, the enamel of the teeth, because the enamel is so impacted by acids and sugar that if you drink through a straw, you're going to, and the same is for coffee, you know, drinking cold coffee or even warm coffee through a straw is going to help get rid of that demineralization on the teeth as well.
Wow, I only drink coffee through a straw when it's cold, so I hadn't even considered doing hot coffee through a straw. But that's really great advice. And so tell us a little bit about Dirty Mouth. I love the powders. They're so fantastic. And, you know, powder versus paste. We grew up with paste and tubes, and yet that's not really where tooth things started at. So give us a little insight into what's in the powders.
Powder is actually just paste without the water. So anytime you pull water out of something, you have concentrated the other ingredients. The problem with most dental products is the other ingredients are really harmful. So a lot of times people think that, you know, powder is really good, but you actually have to read the ingredients. So tooth powder, my tooth powder, Dirty Mouth tooth powder, was created with a blend of 3 different clays. The 3 clays are synergistic so that they help remineralize the teeth. They help neutralize acids. They help break down plaque because they are more alkaline. Plaque is typically an acidic layer based, and it helps to house the bacteria. It's like a little house that the bacteria creates so that the bacteria can hide and burrow down into your gum tissue. And then it also helps pull toxins out of your gum tissue and the mouth tissues themselves. We don't even realize it, but all the heavy metals from tap water and other products that we're using inside our mouth, things inside our mouth, pollution, can enter our bodies through our tissues inside of our mouth. That's your gum tissue and then the rest of your soft tissue. And it's really important to understand that clay binds to these heavy metals and other toxins and pulls them out of your tissues. What's missing from most dental products is something that binds to toxins. So what happens to those toxins is you swallow them and then they get into the tissue another way through your gut, or they get absorbed into your tissues through bleeding gums, broken, vessels in your gums, inflammatory gums, or just your gum tissue in general, because they will absorb in there, even healthy gums, and then migrate into the tissues, into the bloodstream, and then they travel throughout the body. So it's really important to understand that brushing with something that's actually going to detox your mouth and remineralize your teeth is the actual way to go. I blend 3 clays. It's a bentonite clay, French green clay, and white kaolin clay with a little bit of baking soda. The baking soda makes it alkaline. The alkalinity actually kills the bacteria that causes all those harmful things inside the mouth. And it's also going to help break down plaque, get rid of that little barrier so you can get to the root cause of all the other dental problems. And then the other issue is that it's going to help when it's more alkaline, put those minerals back in your teeth. Because remember, during an acidic environment inside your mouth, whether that's when you're brushing your teeth with something that's acidic, you're gargling with something that is acidic, you're eating or drinking something that is acidic, the acids are what wear away at the enamel. So as you're eating or drinking or brushing, if it's acidic, those minerals leave your enamel, and then over time, your enamel gets holes or pits in it. I like to show people, this is like a little, I call it a little moon rock, but it's a little lava rock that I got just from our neighborhood. And you can see the pits and holes in it. And this is the surface of the enamel. And if you're using regular dental products or products that don't have minerals in them, then these pits and these holes never get the opportunity to fill in, because there's nothing that can replace a mineral other than the exact same mineral that left. So if you lose a calcium, or if you lose a manganese, because you have a bunch of different types of minerals, your tooth enamel is typically made up of primarily calcium and phos, but it also has other minerals in it. If you lose a mineral, calcium, it has to be replaced by a calcium, but it has to also be alkaline when that mineral is present. So that's why I created Dirty Mouth tooth powder, so that when you're brushing your teeth and those little pits and holes, the powder is really effective at making it alkaline, cleansing the surface. And since all of the minerals are present, you can start to fill those holes in. I also added hydroxyapatite, which is really huge right now in the dental industry. Hydroxyapatite is calcium and phos, and the exact same minerals that are in your teeth. So not just do you get the benefits of the clay, but you also get the added benefits of hydroxyapatite being in the clay. So when you're brushing your teeth, you can brush those minerals right back in. And ultimately, the goal is to remineralize your teeth, rebuild the enamel so that any pits and holes that are in it can fill in, and the surface becomes super strong, super thick, which basically means your tooth is whiter and your dental checkups are going to be so much better. It's also super friendly to your gum tissue. It's not going to wear away at your gums. It's actually going to allow your gums to start to heal, because a lot of the products we're using wear away at the gum tissue.
Well, and you know, we're brushing, so we're literally like removing something off of there. And then when I just want to reflect back, you know, you're saying acidic and then alkaline. So remember, chemistry, acid and base. So the base is going to neutralize the acid. So it makes a lot of sense why we want to have that alkalinity in our mouth, because it's going to help to neutralize those acids and minimize or get rid of that negative impact that's happening. And then to hear you say that like phosphorus is one of the important minerals in our teeth. Well, of course, then phosphoric acid in the sodas, that's then like tearing the phosphorus out. This makes so much sense why we really need to either avoid sodas altogether, or like we've been saying, drink through a straw. But I love to hear about these clays. Like, I think, you know, we've become so clean and sanitized over time. We forget that when we lived closer to nature, we came into contact with dirt more frequently. And whether that was physically on our bodies or as young children, they're always sticking things in their mouth. And that's because this is where our immune system is. They're testing like what is good for me, what isn't, and they're trusting their guts, right? We need soil-based organisms. And so it makes sense that we're wanting to eat mud pies or to put dirt in our mouth. And here you've created it in a way that the dirt that we're putting in our mouth has a huge benefit to everything that's happening within this system. So, you know, let's say I've got toothpaste sitting here. Obviously, I want to come buy your product, but what are some of those really nasty ingredients we want to, as soon as we see it, danger, you know, toss this away?
Triclosan is one of the biggest ingredients in toothpaste, and it's actually in some of the mouthwashes as well. Triclosan, they did a study, and you do swallow, no matter what, no matter how much you think you spit, you do swallow even a small amount of whatever you're brushing with. So toothpaste, tooth powder, good, bad, indifferent, you do swallow it. If it contains triclosan, they did a study and it showed that it causes dysbiosis, which is an imbalance, and the good and bad bacteria. It actually kills the good bacteria and creates an environment where you end up with the bad bacteria overtaking your gut. That can lead to diarrhea. It can lead to chronic gut infections. It can lead to SIBO, or small intestinal bacterial overgrowth, all sorts of problems. And then those, of course, lead to leaky gut syndrome, leaky brain syndrome, and all the inflammatory diseases inside the body. Besides triclosan, alcohol-based mouthwashes are horrible. Not only do they wear away at your gum tissue, but they kill the good bacteria as well as the bad bacteria. And if you kill everything, you're basically sterilizing your mouth, and you are making it more prone to the bad bacteria being able to take over again. So you're on this vicious cycle of never being able to reestablish a good microbiome inside your mouth. Peroxide is another bad ingredient. It's a big no-no for me. Peroxide, first of all, you talked about having the metal fillings, the amalgam or the mercury fillings. Anyone that has mercury inside their mouth or any kind of metal, peroxide vaporizes the metal. It vaporizes mercury. And so, you know, as you're brushing or using whitening strips or whitening gel that has peroxide, and especially the whitening gels, because they're a higher concentration of peroxide, it's vaporizing those metals, and then you're breathing that in and those fumes. If you have symptoms that, you know, brain fog and extremely tired, you know, weight gain that you can't explain even when you feel like you shouldn't be gaining weight, hormone imbalances, all these different kinds of symptoms, not sleeping well, it could be related to the fact that whatever you're brushing your teeth with could be causing those fumes to be vaporizing, or those metals to vaporize, and then you're inhaling them and they're getting into your system. So peroxide is a big no-no for me. There are better alternatives. I created one. I'll show you in a second. But peroxide also wears away at your gum tissue and kills both the good and the bad bacteria. Swishing with peroxide every once in a while when you have some sort of infection, or if you have a dental procedure, is not that big of a deal. But it's the continuous everyday use, it's the misuse, it's the overuse, it's the high concentration of peroxide when you don't really need it to try and whiten your teeth. The problem with peroxide when you whiten your teeth is that peroxide doesn't actually whiten your teeth the way it should. In order to whiten your teeth long term and make your mouth healthier and your teeth healthier, you really need to regrow or reestablish the enamel. Most of the time, the enamel starts to get so thin that you start to see that layer beneath, which is the dentin. That bluish color underneath your enamel is your dentin. It's blue, gray, or a yellowish color. So when your enamel gets so thin and you look at your teeth and they look almost translucent, you're typically seeing the dentin go through. The reason peroxide whitens your teeth is because I say it dehydrates your dentin. It pulls the fluid out of your dentin and makes it more opaque. So your tooth looks whiter, right? And when you do that, that's like, oh my gosh, what it's really doing is that now your dentin has moisture in there. It has other things. It has minerals in it. It has proteins in it that are antimicrobial, antibacterial, all sorts of things. Because underneath your dentin is your pulp, which has your blood vessels and your nerves. And that's really important because this is why peroxide hurts. If you're doing peroxide and it hurts, that's the biggest sign that you shouldn't be doing it, because it's actually damaging the infrastructure of your tooth, pulling out the moisture, making it super brittle. So you're going to be more prone to fractures of your tooth or splits. And then it's also causing a caustic reaction to your nerves. That's why it hurts. The other problem is every single time you bite, you crunch down, that dentin supports your enamel so that it doesn't break. And it also is the shock absorber so that you don't feel every bite. So when you dehydrate or pull the fluid out with peroxide, you're weakening the actual infrastructure of your tooth, and you're more prone to all the other issues that you can imagine happen, you know, breaking your tooth, cavities, and all sorts of things. Not only that, but, you know, peroxide is then getting into your system and your blood vessels, and it can cause the bacteria to leach in there as well. There's a better option. Peroxide isn't the best way to whiten your teeth. As I said, it's going to pull the fluid out. I created a teeth whitening system that uses light therapy as well as a gel that is peroxide free. And when I said that the best way to whiten your teeth, when I do these things, I do them long term. I don't want people to be spending thousands of dollars every single time they go to the dentist office to have a healthy smile. I want to make sure that we get you to a healthy smile, and it's super easy to maintain. And what that means is that you're going to smile more, you're going to have more confidence, and that you're also going to have better dental checkups, which then means that internally your gut can now heal because you have good bacteria in your mouth instead of swallowing the bad bacteria. You can also have less inflammation in your gums and start to get rid of the inflammation inside the body. So whitening your teeth and strengthening your enamel was my priority number one. So when I developed my teeth whitening system, I created a gel that is peroxide free. It uses olive oil as the base because olive oil is extremely soothing to the gum tissue. It's detoxifying. It's going to help whiten. It's going to help support the good bacteria. And by the way, the good and the bad bacteria are, like we talked about, are opposing. One likes alkaline, which is the good, and the other likes an acidic environment. So when it's alkaline, the other guys can't survive. So it's going to support a good microbiome. It has 2 different clays in it for the same reason. They have the minerals. They're alkaline, and they're going to detox the tissue. It also has hydroxyapatite for the same reason. We can reestablish the bacteria inside the mouth, and the hydroxyapatite will support the remineralization. But the magic actually happens as well with the light therapy. So it has both blue, red, and then the combination of blue and red light on the mouthpiece. So you insert the mouthpiece after you put the gel. I put the gel directly on the teeth. The blue light, I'll walk you through these. The blue light, Harvard did a study, and what they found was that the bacteria, I'll use my little guy, this guy is like the harmful stuff that's living inside your mouth. It causes bad breath. It causes that white coating on your teeth or your gum or tongue, and it's creating the plaque. These guys don't like blue light. When they have this little piece inside of them that when exposed to blue light, they die. So it's really cool. And blue light therapy, just like red light therapy, penetrates into the tissue. So it's not just a surface thing. It could actually penetrate into the pockets in between the teeth, can penetrate into the tissue of the mouth. So you're going to get the benefit not just from the surface, any bacteria living on the surface, but you're also going to get the benefit of the bacteria that could be harbored inside. So it's going to kill the bacteria. It's also going to help whiten the teeth. It's going to help the gel work better. The red light is really awesome because think of red and your gum tissue. Red, it reduces, just like red light therapy for your skin. People use it for years just to get that glow back, regenerate their skin tissue. It boosts collagen, which is why people use it for their skin. But it's also going to boost collagen. It's really important that you have collagen in your gums and your bone, the bone inside your jaw. So it's going to boost collagen production. It's going to reduce inflammation, and it's going to increase blood flow. All three of those, that trifecta, is like the winner for regenerating or stopping the process of gum degeneration, and the healing process can then begin. I have had customers go back to the dentist after using the red light, and their numbers, you get the 1, 2, 3, 4, 5 numbers of your gums and how much they bleed or how weak they are. And their gums greatly improve after a very short amount of time of using red light therapy. And then of course the blue light, the red and blue together, I typically tell people this is great if your gums and your teeth are healthy, use them together. If you're having one or the other issue, do them separately. But no matter how you do it, even if you did it with the combination and you were having some issues, you're going to get the benefits of the red and blue light. And that long term is going to really help your mouth become healthy. And you're going to end up with whiter teeth.
There's so much great information. It's super exciting to hear that there are these low cost, really effective ways that we can avoid being in that dental chair, having all kinds of surgeries and drillings and whatnot in order to make sure that we still have teeth into our older age. Because obviously they're so important to helping with digestion. And it makes so much sense that this is our first line of defense, and that we need our oral biome to be really strong and healthy to prevent those bad bacteria from even getting inside of us in the first place. And so taking oral healthcare really seriously is really important. And, I noticed one of the ingredients you didn't say was in your products is fluoride. And of course, we've been told for years that fluoride is so important, and they put it in the water and this and that. But what are your thoughts on fluoride?
Fluoride's not naturally in your body. When you were born, you should not have any fluoride in your body. And ladies, and it's so hard. It's a catch-22 when I say this because people get upset. But, especially when you get pregnant, if there's any fluoride in your body, or there was fluoride in your mom's body, that's the way that babies are born, with fluoride in their body. It's passed through mom to baby. And the best thing to do is stop using fluoride, because fluoride causes, it's a neurotoxin, and it also causes a lot of other health issues inside the body. You're not really, fluoride is not naturally found in the body unless it's put there. And the best thing to do is help get rid of it. Once it gets inside your mouth with the dental products or the foods that we're eating, the water, because of course they fluorinated water, they can find fluoride in your bone. What happens with fluoride, and the reason that they thought that it was going to be this miracle thing, is that they felt like it was going to be stronger than your teeth. It was going to make your teeth stronger. The problem is it really doesn't. And the research that proved that has been buried. The original research that they found and said fluoride makes your teeth stronger, actually years later, as they continued studying, they found that that was not true. So they buried that. They don't really want you to know that. The best thing that you can do, and this is my opinion, obviously, just from years of research and knowing and seeing how using the right minerals inside your mouth, the right formula of products inside your mouth can actually reverse what's happening inside the mouth. I actually had a customer one time that had 6 cavities. One needed a root canal. And she had bought some dirty mouth tooth powder a couple months, or about a month or 2 before she went to get her root canal, as a last ditch effort to help save the rest of her teeth. Because remember, whatever's happening inside your mouth causing that one tooth or 2 teeth to have problems it's doing the same thing and wearing away at all of your teeth and gums. So she went to get her root canal and she sat down in the chair and the dentist looked inside her mouth and sent her home because she had one cavity and it did not need a root canal. So we saved her from needing a root canal, healed the rest of her teeth, and you know, she got sent on her way. She didn't have the pain. She didn't have the pain from the drilling or the billing. And you know, she really didn't spend that much. She probably spent 20 bucks on a tooth powder. And now I've developed not just the teeth whitening. That was 10 years ago that happened, or about 8 years ago that happened. But I actually developed a dental detox kit that has not just the tooth powder. You have a morning and nighttime tooth powder, but it has all the other things, a gum serum that replaces mouthwash. You have a tongue scraper to get rid of the bacteria on the tongue, and a toothbrush that is going to have some charcoal in the bristles to help detox and cleanse a little bit better as you brush. So I created a dental detox kit and the LED to help everyone be able to have better dental checkups. But fluoride for me is something that's not necessary and has more harmful effects on the body, not just the teeth, but the body as well, than good. And there's really no reason for it.
Well, and same with the mercury. So this has just long baffled me. Why, if we know that mercury is so dangerous and deadly, why are we putting it in our mouths and pretending like this is something that's perfectly safe and normal? And, you know, of course, I don't know, my dad had really good insurance. And so I ended up with like every dental procedure out there as a kid. I had sealant put on my molars. I had just all kinds of stuff that probably wasn't really that necessary if we had been using the right products, or you know, who knows? The dentist said we needed it, so we got it. I've had a root canal, I had a tooth pulled, so I've been through a lot of different things. But honestly, since, you know, taking the fluoride out of my water, I have a fluoride filter at the point of my drinking water so that I don't have to take that in. Since I went and I replaced all of my amalgams, like my mouth is really happy and healthy. And if I do feel a little tenderness in there, I'm going to chew on a clove and that's going to quickly clear everything up. But when are they going to wake up, Trina? I mean, thankfully you're out here helping everybody, but it's so baffling why these would even continue to be perpetuated.
I don't know. And there are dentists that are still putting amalgam or mercury fillings inside the mouth. The other problem is it's not just mercury. There's other metals that are in some of these fillings. And the problem, which you know, is really a huge problem, but people don't know this, is that when you have like a mercury filling or one type of metal up here, and then you have a different type of metal down here, every time you bite, those opposing metals create like some sort of electrical current. So every time you're biting, if you have metals inside your mouth, just think of what that's doing to your neurological system. Not just the fact that you inhale those fumes if they get broken down, but the fact that every time you're biting, those metals are fighting each other and creating this electrical current. So getting, like you said, finding the dentist and the right type of dentist. I always recommend looking for a biological or a holistic dentist. It's worth it. Even I live in Ohio and my dentist is in Scottsdale, Arizona. And so I actually fly because she's an amazing dentist, and I fly twice a year or more if I need to go see her there. So I always tell people, if you have to drive an hour to see a biological or a holistic dentist, it's time well spent, because they're not just going to look at your mouth. They actually see the whole picture and they know that it's connected. So they actually do a better assessment of not just your mouth, but your jaw and your facial bone structure and, you know, your neck and all sorts of things. So it's really important to do that. Making sure that if you do have metal fillings, trying to get them replaced, like you said, with something that's more friendly to the body, like a porcelain. Getting them removed, you're going to feel much better in the long run. And then making sure that you're detoxing out those metals. The tooth powder that I created is going to help get rid of the metals or any of the toxins that are in the tissues of your mouth, but the rest of the body is extremely important as well, as we all know. You know, one thing is linked to the other, and you know, you have to, it's a process. You can't always do it overnight. It might be a year-long process of cleansing your body and getting rid of stuff. But in 1 year from now, if you can be healthier than you are right now, able to get out of bed, stop having brain fog, you know, being able to not have those, you know, hormonal, you know, fluctuations, losing the weight that you might want to lose, and just feeling better all over. And then being more confident as you smile, your relationships get better. You know, it's proven that people that smile more or have a healthy mouth have better jobs, whether it means you get promoted more or you're just doing a better job because you feel more confident. It's really important because it impacts every aspect of your life.
Absolutely. Now, if I had metal fillings and I started to use your tooth powder, would that be an issue? Is it going to, you know, pull stuff out that maybe my body can't handle?
Well, it's going to detox it out of your tissues, but it's not going to harm any of them. And all of my products are okay to use with any dental products or any dental procedures, anything that you have inside your mouth. They're not harmful. They're extremely gentle on your gum tissues and your teeth. Your not just your enamel, but any kind of fillings and things like that. So it's really safe. So yeah, it's eye-opening when you start to realize how many things in the dental industry, if you're using natural products, because I would imagine some of the people that follow you, they're inspired by healthy things, obviously kombucha and other types of things, might be thinking, oh, I use a healthy natural toothpaste or tooth powder already. What I invite you to do is look at the ingredients, because if it's missing anything that has minerals in it, hydroxyapatite or clay, then it's not actually going to be putting those minerals back in your teeth and making them stronger. It's still going to be supporting that demineralization process. You need minerals in there. The other thing is it has to be alkaline. I tell people to make sure it has baking soda. That's probably the best ingredient to look for. If it doesn't have clay and or hydroxyapatite plus baking soda, still not going to work. You can have all the minerals right here, but if it's acid or if it's not alkaline, those minerals are either going to be swallowed or spit out. They are never going to get back into your teeth. So it has to be the way that it's formulated. It has to have the minerals and it has to be alkaline. So those things are extremely important. That's the way that I created all of my dental products. I tell people when you start my program, don't use anything else, because most other companies don't understand, or they're not formulating them for the benefit of your health or your teeth. They just want to clean your teeth. They want to clean them so good they're killing everything. That's the process. They want to clean your teeth because they think that's what you need. And to be honest with you, if you brush with water, you can actually be doing more good than if you're brushing with something that, you know, has the harmful stuff in it or isn't benefiting your mouth. If you are using a natural product that has glycerin in it, the G word, the glycerin's a big no-no for your mouth, because glycerin puts a Band-Aid coating like saran wrap over your teeth, and it prevents the minerals from getting in. So make sure that there's no glycerin in any of your dental products as well.
This is such great information, and I'm sure that everyone listening is super excited to learn more about how they can get a hold of some of your amazing products. So how do people find you, Trina?
The best way to find me is primallifeorganics.com, but I'll tell you, if you're interested in either the teeth whitening kit or the detox kit, if you go to naturalteethwhiteners.com, you can get the teeth whitener, and the dental kit will show up at a much reduced price. You'll receive 60% off. So naturalteethwhiteners.com. You can also, if you don't want the teeth whitener and you just want the detox kit, you can either purchase it on the website, or you can go to dentaldetoxbox.com and get it there as well. And you can also get more than one and save even more. So, and if you have any questions, my support team is extremely helpful. Just email support@primallifeorganics.com, and we'll get your questions answered and the right products in your hands as soon as possible.
Yay! Well, we would love to give something away or offer a coupon code. So let's connect and figure that out so we can share with everybody. They can, make it super easy for them to make that decision to go ahead and grab a great tooth powder, to toss those toothpastes that aren't really helping, and to get to the root cause of what some of these things are, and to help clear away, to lessen the impact. We're surrounded by toxins, we're inundated with them, and anything we can do that's going to help to eliminate, reduce, is going to be amazing. So thank you so much for sharing your time here today, Trina. So good to see you. And we'll look forward to sharing all this information with our folks. So thank you so much.
Thank you. Always amazing seeing you as well. And thank you for mouthing off with me. Bye, everybody.
Bye. So we learned a lot today, and we got really empowered because when we realized that we have far more control over how our body responds just based on the things that we're putting into it, that allows us to make choices that serve the greater good of our entire system. And when we are getting to those root causes, so whether you're getting to that root cause by drinking kombucha, and that's helping to detox the liver and any sort of stored toxins in the body, it's so important that we're detoxing the mouth as well. And so checking out the products that Trina has, it's amazing. She's created these really well-researched, really well-sourced products that are going to give your mouth a lift. And so if you've had any issues with your oral biome, if you've had any tooth issues, if you've been to the dentist and they say you have cavities, before you dive in and get those filled and choose the lower cost amalgam, sometimes we have to make that choice because of cost, go ahead and just spend the few dollars to get this. It might cost a little bit more than your regular toothpaste, but the reality is long term, that cost is going to be a lot less expensive because you're not going to be sitting in that dental chair. You're not going to have the drilling and billing, as Trina said, and that's going to be a really great way for us to support all aspects of our being. So thank you so much for being here today. Like, share, follow if you enjoy our content. We just want to help more people get healthy, and thank you so much for being here.